We're going to begin our presentation by mentioning our three objectives.
By the end of the presentation, about 90% of the students will be able to identify the two major types of mental health issues the homeless face in the United States.
By the end of the presentation, 90% of the students should be able to list three resources available to the homeless population dealing with some type of mental illness.
By the end of the presentation, 90% of students will be able to identify at least one precursor associated with mental illness in the homeless population.
We will first begin the presentation talking about cultural competence within the homeless population. Now, as the gap between the rich and the poor increases, the vulnerability of individuals and families becoming homeless increases as well. The homeless population is an interesting population in which all experiences and drawbacks on how homelessness occurred is largely heterogeneous, meaning there is no direct correlation or experience that all homeless individuals went through. Keep this in mind in regards to the understanding of cultural competence within the homeless. As a health educator, being culturally competent with your target population is essential in eliminating bias, judgment, poor care, and the barriers that arise from a program. There are multiple subgroups that arise from homelessness. These subgroups consist of individuals who have a military background, immigrants and refugees, and the LGBTQ community. It is crucial in acknowledging the different subgroups and their personal and future health care necessities through effective health promotion programs. Therefore, awareness and empathy are vital in providing competent care for the homeless. Lastly, a large barrier in reducing and improving homelessness is policy making. Policy should also be culturally competent, adequately informing legislators on differences and living conditions of the homeless can introduce successful initiatives and efficient policymaking and beneficial funding. In regards to mental health and culturally competent care in the homeless, several factors undermine the necessity for patient direct care. The elimination of biased assumptions within the healthcare environment on how an individual becomes homeless is rather malinformed. For example, substance abuse preassumptions can blind providers on directing the proper care of homeless individuals, in which they might even neglect care. In reality, there are societal and psychological factors that place individuals at risk for becoming homeless. Substance abuse, like previously informed from our guest speaker, occurs after homelessness is undergone.
Next, I will be talking about epidemiological data. Some questions that might come up are, how do people become homeless and how is mental health associated with the homeless population? Let's go into a little about the demographics. 16% of the adult homeless population suffer from some form of severe and persistent mental illness. 5 to 7% required to be institutionalized. 65% suffer from some sort of addiction. In general, as of 2017, families and single mothers make up one of the largest groups of the homeless. Children alone then follow. More specifically, 39% of the homeless population are children, and of that, 42% of them are under 5. 25% range from ages 25 to 34, which makes up the most prominent age range. 6% are 55 to 64. Something to keep in mind is that it is actually hard to gain statistics about the homeless population because they are constantly moving and the demographics are always changing. According to the National Coalition for the Homeless, inadequate income, the issue of no affordable housing, and people leaving from situations of domestic abuse are the main reasons for homelessness. To add on top of that, rural areas tend to have higher percentages of homeless than urban areas, and because of this, it causes a high state of poverty and low quality of life.
The two main types of mental illnesses are post-traumatic stress disorder and schizophrenia. It is important to keep in mind that untreated mental health is a risk factor to being homeless, and being homeless is a risk factor that can lead to mental illness. According to psychotherapist Amy Morin, 11% of homeless are veterans. 11 to 20% of that are homeless veterans who suffer from post-traumatic stress disorder, also known as PTSD. The question is, why do veterans become homeless with PTSD? A big factor is that they did not receive adequate treatment for traumatizing events that happen in war. PTSD affects one's moods, cognition, and reactions in a negative manner. Individuals who suffer from PTSD are often tense, always on edge, have sleeping issues, and tend to have angry outbursts. Not only does it affect a person's health, but it also affects one's social life and ability to cope. There are also comorbidity factors associated with PTSD, including depression, anxiety, and substance abuse. To add on, homeless individuals are highly susceptible to a variety of acute and chronic illnesses. The most common antecedent of homelessness is chronic schizophrenia. As mentally ill individuals, it is extremely difficult to cope with their surroundings, especially being alone, living on the streets with no support. Symptoms include hallucinations and delusions. According to the National Alliance of Mental Illness, schizophrenia is a long-term mental disorder that interferes with a person's ability to think clearly, manage emotions, make decisions, causing faulty perception. According to a study done by the National Alliance to End Homelessness, schizophrenia affects more than 1% of the U.S. population. However, it's much more prevalent in the homeless population. 20% of homeless have schizophrenia. Putting those numbers into perspective, that's thousands of people living with schizophrenia and experiencing homelessness each day. Even though the homeless community suffer from other severe mental illnesses such as PTSD, bipolar disorder, or severe depression, schizophrenia is the most burdensome.
To reiterate, let's take a closer look at some of the specific concerns with the two main illnesses, PTSD and schizophrenia. PTSD triggers the flight or fight response in situations where it's not needed. Homeless with PTSD experience four concerns: avoidance, negativity, flashbacks, and arousal. Avoidance deals with wanting to avoid certain places, events, or objects due to traumatic experiences. Those with PTSD will also have to deal with at least two cognitions and mood symptoms. These cognitions can cause the person to have negative feelings for themselves and the world around them. Flashbacks pose physical symptoms such as sweating and elevated heart rate. It can also cause bad dreams and thoughts which may make them feel like they are in immediate danger when there is no threat present. Those with PTSD also experience some type of arousal or reactivity because of a perceived memory. They are easily startled, always tense, and can have an angry outburst. For homeless with schizophrenia, they are mostly concerned with lack of sleep due to constant hallucinations. They have social withdrawal due to irregular speech patterns and impaired attention. They can also be very apathetic, which can lead to poor hygiene and lack of proper self-care. In terms of general concerns, their illness can become worse or lead to more severe illnesses. They lack proper nourishment. Statistically speaking, 28% of homeless obtain food from garbage, and 8% use garbage as their primary food source. They're also more prone to physical abuse and criminal acts. People have a negative stigma attached to homeless and overall sometimes end up in jail. In terms of living conditions, 69% live in emergency shelters, while the other 31% live in the streets. Finally, there's income. Due to the lack of social skills and mental capability, it is hard for them to sustain a job and maintain a stable income.
Next, I will be discussing some interventions that have helped improve the life of homeless individuals suffering from mental illness. Research on interventions to improve the health of homeless people have received significant attention over the past 5 years. One intervention is primary health care. Primary health care programs specifically tailored to homeless individuals might be more effective than standard care and are more likely to achieve higher patient-rated quality of care. In an observational study, homeless individuals rated the quality of their care substantially higher than homeless patients receiving care at mainstream primary care sites. Another intervention is mental health care. All mental health programs for homeless individuals should have an integrated approach that accommodates and meets the needs of people with co-occurring mental illnesses and substance misuse disorders. Critical time intervention services are effective for individuals transitioning into housing. So, housing first, with immediate provision of housing and independent units with support, improves outcomes for individuals with serious mental illnesses. Homeless specific services provided by non-governmental organizations with a few mental health professionals as staff can improve access to services and respond to immediate needs, but healthcare organizations with special provisions for serving homeless individuals are more effective in provisions of high-quality mental health care. Another intervention is permanent supportive housing. For chronically ill homeless adults, being discharged from hospital provisions of case management and supportive housing is effective in the reduction of hospital use. Also, interventions that provide case management and supportive housing have the greatest effect when they target individuals who are the most intensive users of services. The last intervention that I will be discussing is medical respite programs. When people who are homeless are admitted to a hospital, discharge planning might be problematic. When the patient recovers to the point where he or she is well enough to leave the hospital, but they are still too ill to return to a shelter or the street. Medical respite programs provide homeless patients with a suitable environment for recuperation and follow-up care upon leaving the hospital, reduces the risk of readmission to hospital and the number of days spent in the hospital. All the interventions that I have mentioned before have all helped to improve the lives of those individuals that are homeless and suffering from mental illnesses. Next, we will be discussing a nonprofit community organization that has helped improve the quality of life of homeless individuals suffering from mental illnesses.
A nonprofit organization that is located in LA County is called Homeless Healthcare Los Angeles. Not only do they provide housing for the homeless, but they also have rehabilitation services as well as treatments and training. They offer integrated treatment programs and have helped thousands of individuals annually, as shown in this figure.
Homeless Healthcare Los Angeles is certified by the California Board of Registered Nursing, the California Association for Alcohol/Drug Educators, and the California Association of Marriage and Family Therapy. Some of you may be asking, so how can I contribute to this program? How can I help out the community? A simple way to do so is by donating. So the funding for this program is very important. For every $5 donated, there is an overdose kit provided to the clients. And for every $100 earned, there is household items such as blankets and sheets given to the newly housed clients. And for every $250, there is a case management and detox medications that are provided. And for the big one, which is $500, it earns a full year of case management services. In addition, there are volunteer opportunities that the Homeless Healthcare Los Angeles offers, and as a nonprofit organization, they would really appreciate the help. On top of that, you are able to attend training seminars that are involved with behavioral health, boundaries and ethics, burnout prevention, cultural diversity, domestic violence, harm reduction, LGBT plus awareness, motivational interviewing, and many more. Overall, this is one of those organizations that provide an extensive amount of support and outreach for the homeless community that suffer from mental health, and as a group, we would highly recommend supporting the cause.